Inicialmente,
Firstly, I'd like
agradecemos
to
o
thank
convite
the
para o Brasil
invitation to
co-patrocinar o
Brazil to
evento de
co-sponsor the
comemoração
event
ao
in
Dia das
commemoration
Doenças
of the
Raras
Rare
de
Disease Day
2021 e
2021,
parabenizamos pela
and we
dedicação à causa.
congratulate
É um
the
prazer
dedication to this
participar
cause.
com vocês.
It is a
O
pleasure
Dia
to
das
take
Pessoas
part
com
in it
Doenças
with you.
Raras
Rare
evidencia a
Disease Day
existência dessas
highlights the
doenças e
existence of
desperta a
such
necessidade
diseases
de
and
inclusão
evokes
desses
the need to
cidadãos.
include people with
Precisamos
rare diseases.
fortalecer o
We need
conceito
to
de doenças
strengthen the
raras,
concept of
destacando
rare
as
diseases,
capacidades desse público
emphasizing the
vulnerável.
capacities of the vulnerable group.
No Brasil, estimamos que cerca de 14 milhões de pessoas são afetadas com doenças raras.
In
Desde
Brazil,
janeiro
we
de
estimate that
2019,
around 14
todas
million
essas
people
pessoas
are
passaram a
affected by
contar
rare
com
diseases.
uma
Since
representação dentro do
January
nosso Ministério,
2019,
a Coordenação
those
Geral das
people have a
Pessoas com Doenças
representation
Raras,
within the
a
ministry,
Secretaria Nacional
which is the General
dos
Coordination
Direitos
of
das
Persons
Pessoas
with
com
Rare
Deficiência,
Diseases of the National
criada
Secretariats
para
of the
garantir
Rights of
direitos,
Persons with
ouvir as
Disabilities,
necessidades, promover o
created to
avanço da
guarantee
legislação
rights,
de
hear the
inclusão
needs,
e estimular
promote the
ações dirigidas
advancement
a
of
essa população.
legislation and inclusion towards that population. The creation of the
criação dessa
coordination
coordenação
demonstrated
demonstra o
that our
reconhecimento do nosso
governments
governo
recognizes
de
that
que
the
todos os
rights of
direitos
people
dos
living
raros
with
devem
rare
ser
diseases
respeitados.
must be respected.
E seu grande
Its
diferencial
great
é sua
particularity
atuação de forma
is a
holística
comprehensive and
e sob
human
uma
rights
perspectiva
approach.
de direitos humanos.
The main competences of the coordination are
São
identifying
atribuições da
and
coordenação
proposing action towards the
identificar e
protection
propor ações
of the
voltadas para a
integrity
proteção
of
de
persons with
integridade
rare
da
diseases,
pessoa com doença
as
rara,
well as articulating
bem
measures
como
with
realizar
other
articulação
public
com outros órgãos
agencies
públicos
and civil
e com a
society.
sociedade civil.
In 2020, the coordination adopted important
2020,
measures in this
a coordenação
context,
concretizou
such as
ações
a
importantes
partnership
nesse
with a
sentido,
Brazilian university to
como
develop
parceria
extension
com a
courses,
Universidade
learning
Brasileira no
objects, and
desenvolvimento de
inclusion
cursos de
on the rare
extensão
diseases
e
matter,
objetos de aprendizagem
and
e
also a
inclusão
complaints channel at the
órgãos de
Ombudsman
doenças
for
raras,
Human Rights to offer
nos canais de
information and
atendimento da
supports
Ouvidoria Nacional
for
de
patients,
Direitos Humanos
families, caretakers
para oferecer
throughout the country.
informações e apoio para pacientes, familiares e cuidadores de todo o país.
E outro
Another
exemplo
example
dessa
in these
atuação foi a
fields is the
criação do
creation
Comitê
of the
Interministerial
Interministerial
de
Committee
Doenças
of Rare
Raras, com a
Diseases, with the
participação de diversos
participation of
ministérios.
several
É
ministries.
espaço de
It is a
articulação e
forum
alinhamento
for
de
articulation
políticas públicas
and
sobre o
alignment
tema
of policies
entre
on
diversos
this
órgãos.
issue
O
among
nosso
several
governo está
government
olhando
bodies.
com
Our
muito cuidado
government
para os
is
raros
carefully
e suas
watching over
necessidades,
persons with rare
agindo para que
diseases and their
saiam da
needs,
invisibilidade.
acting
São
so that they
pessoas
can
que,
live
com
in
suas
visibility.
particularidades,
These people
também vivem em
are,
nossa
with their
sociedade e
singularities, also
merecem
living
nossa
in our
atenção.
society
Muito
and deserve
obrigada.
our attention.
Dear participants, I would like to sincerely thank the organizers of this event, Rare Diseases International, NGO Committee for Rare Diseases, and Rare Diseases Europe for their inspiring efforts towards improving the livelihoods of persons living with a rare disease. It is our honor and privilege for Brazil to join the core group and support the call for a UN resolution on rare diseases. The discussions related to rare diseases are multifaceted and have impacts in every aspect of society. We must also bear in mind that persons living with rare diseases, and sometimes even their families, face discrimination and stigma, and are often denied equitable access to health and to social and economic opportunities. Hence, addressing the specific circumstances of persons living with a rare disease is, above all, a matter of human rights that should be conducted with a global perspective, in line with the Sustainable Development Goals and Agenda 2030 for Sustainable Development. In that sense, calling for a UN resolution on this issue is not only timely, it is overdue. The Brazilian government, mindful of the topic's cross-cutting aspect, has recently reaffirmed its commitment to persons living with a rare disease by establishing an interministerial committee on rare diseases under the leadership of the Ministry for Women, Family and Human Rights. Moreover, to celebrate Rare Diseases Day, the Brazilian government promoted in February a series of online public dialogues with experts and members of civil society to discuss the current challenges faced by persons living with a rare disease, both in Brazil and around the world. While the COVID-19 pandemic has further aggravated the lives of the most vulnerable, including persons living with a rare disease, it has also shown the world the importance of global action and cooperation across borders. Therefore, presenting a non-controversial resolution on rare diseases at the United Nations could bring this issue to the broad attention, granting it the global relevance it deserves and fomenting action based on recognized scientific practices. In conclusion, Brazil is grateful for the opportunity to join your efforts in advancing the rights of persons living with a rare disease around the world and stands ready to collaborate with member states, international organizations, and civil society to improve this cause. Everyone matters, and now is the time to shed more light on the topic of rare diseases in the international arena. Thank you.
I'm so honored to be part of this event celebrating Rare Disease Day. The state of Qatar believes in a world in which no one is left behind. No disease is left untreated, and every patient deserves treatment and support, no matter their disease or where they live. We view rare diseases as a public health priority, and we have clear policy frameworks and strategies prioritizes to improve care for people affected by rare diseases. We are one of the few countries in the world to have a dedicated facility to treat this condition, the National Center for Rare Diseases in Doha. The center is exploring new ways of delivering better patient care, education, training, and research. Most importantly, the center is working to improve the lives of people living with rare diseases, not only in Qatar, but also in the region. People all over the world who live with rare diseases have been left behind during the COVID-19 pandemic. Creative solutions are needed to ensure the estimated 475 million people globally living with a rare disease have access to healthcare, whether there is a crisis or not. The state of Qatar reaffirms its commitment to support countries and the international community to address the need of those living with rare diseases.
Depuis toujours, la France est en pointe dans la lutte contre les maladies rares. Elle a été le premier pays en Europe à élaborer et mettre en œuvre un plan national concernant ces maladies. Cette journée internationale des maladies rares est l'occasion de rappeler que la France veille depuis des années à faire entendre aux Nations Unies la voix des 300 millions de personnes vivant avec une telle maladie. Nous avons aussi parrainé en 2016 la création à l'ECOSOC du comité des ONG pour les maladies rares. Celui-ci œuvre depuis lors pour améliorer l'inclusion dans nos sociétés des personnes vivant avec ces maladies, alors qu'elles sont encore trop souvent stigmatisées. La France co-préside aussi le groupe des Amis de la couverture santé universelle. Elle s'est mobilisée à ce titre pour qu'un effort prioritaire soit fait pour y inclure les populations vivant avec une maladie rare. Cet appel a été pris en compte dans la déclaration politique sur la couverture sanitaire universelle adoptée en septembre 2019. La France poursuivra cet effort que la crise de Covid-19 a rendu encore plus nécessaire. L'objectif de pouvoir vivre en bonne santé, qui figure parmi les objectifs du développement durable, doit s'appliquer à tous, et notamment à celles et ceux qu'une maladie rare rend plus vulnérables.
Excellencies, distinguished delegates, ladies and gentlemen, I would like to thank the organizers of today's event, Rare Diseases International, and partners for highlighting the important issue of rare diseases at the United Nations community and for giving me this opportunity to add Thailand's voice to the conversation. The last time I spoke on Rare Disease Day was in 2019 when I was co-facilitating the negotiations of the political declaration of the high-level meeting on universal health coverage. At that time, no one could have imagined how a pandemic would change the way of lives of every person around the world. The COVID-19 pandemic has reminded us once again on the need for countries to invest in strong, resilient, and agile health systems. Under the concept of USC, Thailand believes that all people must have access to health services medicines and treatment without discrimination and without exposing them to financial hardships. People diagnosed with rare diseases face difficulty even in accessing treatment and have to bear the high cost of medicines, with the exact reason of this treatment and medicine being so rare. We need to pay more attention to address the lack of knowledge and expertise and the absence of disaggregated data on rare diseases while fostering research and innovation in rare diseases. In October 2019, Thailand added the initial 24 rare but severe diseases of inherited metabolic disorder to our USC scheme. Government budget has been allocated to cover the cost of treatment and medication for patients with these 24 diseases. A committee on rare disease was also established under the National Health Security Office to develop measures to address challenges of managing rare diseases, such as coming up with the definition of rare diseases under domestic policies and laws, improvement of referral system and data sharing system, and building the capacity of medical personnel and institutions. For the next step, Thailand is working on expanding the USC scheme to screen newborn children for inherited metabolic disorder all over the country to be able to provide them with timely treatment. Achieving USC and leaving no one behind, including those with rare diseases, is a much broader agenda than health alone. It addresses the structural challenges of inequalities, discrimination, and social development as a whole. We also believe that government must join hands with civil society and other stakeholders in making this agenda a reality, as we all have a part to contribute in this effort to genuinely leave no one behind. With this, Thailand commends the initiative to propose a resolution on rare diseases at the United Nations in New York and looks forward to working with you all in the process to adopt this important resolution in the coming months. I thank you.
Dear friends, my name is Agustín Santos Maraver. I'm the Spanish ambassador at the United Nations. The 4th of March, we celebrate the Day of Rare Diseases. 300 million people, not a small number, suffered from rare diseases in our planet. And they don't have the same treatments and the same opportunities to be taken care, to have research on their diseases, to be treated with the equality that the rest of us. No, because they are divided in very different and difficult treatments, they have to be one by one taken care, and that complicates and makes it very difficult to try to tackle their illnesses. There are three big organizations that represent them: the International for Rare Diseases, the NGO Committee for Rare Diseases, and the European Eurordis. The three of them are working to try to push forward a resolution at the United Nations that would try to focus on these rare diseases and try to find solutions for the problems. For us at the United Nations, this is a very important exercise, because if there's anything that will prove that we are advancing in the objectives of the Agenda 2030, will be the rare diseases and how we treat them. Because if we leave them behind, that would be a terrible message for all other circumstances or other special situations that also need to be tackled in a specific way. So please think about those 300 million people who need the social opportunities to have normal lives, a non-discriminatory education and access to work, health, treatment, care and research for their own very specific illnesses, and support and help us to carry on with this resolution at the United Nations. Thank you very much.